Every health facility responding to violence against women should have a uniform mechanism for documenting cases of violence. Just like documentation of other healthcare services within a facility, a protocol for documentation of cases of violence should be implemented. Let's say, a simple 2-page structured format that can be filled by doctors, nurses, social workers, and counselors at primary, secondary and tertiary level, to document cases of violence against women. The format captures the way violence is reported or disclosed at the health facility by survivor. Provider asked about violence and woman disclosed. The healthcare provider should tick this option if the provider has suspected violence based on woman's health complaints, asked woman about it, and woman has disclosed it to provider. Woman reported violence to healthcare provider. The healthcare provider should tick this information. If woman has reported violence on her own to healthcare provider, this usually happens in cases of assaults, where women give violence as cause of her injuries while providing history to provider. Provider suspected violence but woman denied. The healthcare provider should tick this option. If the provider has suspected violence based on woman's health complaints, have asked woman about it and woman has denied it, the documentation of such cases is important. If woman comes to health facility in future to seek support services, the format includes demographic details of the survivor like name, age and her safe contact details. These contact details include the phone number and address where we can call her for any follow-up support services without jeopardizing her safety. Further, the name of healthcare provider along with department and designation is documented to monitor the facility response. There is documentation of presenting signs and symptoms, which require healthcare provider to document the health complaints for which woman has come to seek healthcare. The providers should document woman's experience of violence by asking about forms of violence experienced and relationship with abuser. Lastly, healthcare providers should document the services provided to survivors of domestic violence. This protocol is useful in assessing the quality of care being provided to survivors by health facility, identifying the challenges faced by providers in responding to survivors and also for provision of follow-up services to survivors.